In honor of Breast Cancer Awareness Month, I thought I would share my personal journey with 2 breast cancer scares. Now, straight up, I do not want to be misleading in any way, shape, or form. These are scares. I never have had breast cancer up to this date. So I don't want to be misleading. I just wanted to share my personal journey with what has happened to me and the process in which I went through, just to help educate people who are about to go through this similar process or currently, just so you know what some possibilities are and what some people experience. So about 14 years ago, I did find a lump in my breast and I did journal it on YouTube, but it's like a long time ago, at least 14 years ago. So I won't make you hunt and find them. I'll just give you the basic story here. So I had just given birth to my second son and was nursing him. And while I was nursing him, I discovered a lump in my left breast. And I honestly could not remember if it was there before or not, because I wasn't very good at self-examinations. So I did go into my doctor's office and she examined me and she was very concerned. She didn't think it felt like a new lump. It felt like something that had been there for a while. And so she was pretty concerned. So she sent me into, referred me to the hospital that was in the area that I lived, because I lived in Vancouver at that time. So a hospital that really specialized in breast cancer. And so, she referred me. It took some time, but I did get in, and they did not do a mammogram because I was nursing, right? They didn't want to squeeze them, but they did do an ultrasound, and they were hoping at the ultrasound to give me the all clear, but they did see something themselves, and it looked to them to be a cyst, but it wasn't a clear fluid cyst. So they were a bit concerned about that, because with breast cancer, sometimes if you do have a cyst and it's murky in there, then they do need to investigate further. So that's what they did. They set me up for a future appointment to be able to get it biopsied. So I went in, got it biopsied, and while they're doing the procedure, they're of course looking at a monitor to make sure they get the exact location of the biopsy. Lo and behold, during that procedure, they realized that the cyst that I had in there was due to breastfeeding, or had filled up with breast milk, like something like that. I can't remember if there's an exact term for this situation while you're nursing, but it was just a cyst filled with milk. So while they were doing the biopsy and they were taking out a sample, like trying to drain some of the fluid from the cyst, it came out as a breast milk, and they're like, oh. And then, a few seconds later, it filled back up. And they're like, oh, okay, this is just, it's not cancerous. It's benign, of course. It's because you are breastfeeding and it is breast milk. Now, I did not have this situation arise with my first child. So it was something new to me in my body. But let me tell you about that situation. There is a part of me to this day that is so frustrated that nobody told me that was a possibility. You can imagine, I being a new mom of my second child, 2 kids, 2 and under, and freaking out because she found a lump in her breast. You can imagine the fear that was in me, thinking, oh my goodness, how am I going to go through treatment and possibly surgeries? Because your mind's going to the worst case scenario, especially when your doctor's alarmed. Oh my goodness, it was so scary and emotionally just hard, because that time hormonally within a woman's body is already, for most of us, emotionally quite a challenge. So to put that on top of it was something else for me. And I just really wish that somebody told me that could be it. because then at least I would have that in the forefront of my mind. I would still get it investigated because you need to get those things investigated. But at least I wouldn't have the worst case scenario being first and foremost. It would be, could be a milk cyst, or it could be something benign, or it could be something serious. That would have been really nice to know. All right, so after I finished nursing him, it went away. So the lump was no more. When I got pregnant with my third child, I was really nervous about just psychologically being scared about feeling a lump, even though I knew that it could be a breast, like a breast lump from a milk cyst. So I was doing like my breast examinations, really trying to memorize what they felt like, where the lumps and bumps were. And yeah, and with my third child, nothing. I did not have a milk cyst. So that was really nice. It was also during this time that I really learned how hard to push down and firm to push down on your breast to do a self-examination. Before I would just do, you know, what they would tell you to do. And I thought I was doing it correct. And I was pressing like, you know, down, but not like hard. And when the doctors go in to examine you, they push pretty firmly. So that's something I learned as well to do. That was one of the, I guess the second most important thing I took from the situation. Number one, milk cysts exist. Number two, press firmer with your self examinations. All right, so now fast forward quite a few years and I hit the age of 40 where, you know, women should be going and getting mammograms. And I do have a family history of breast cancer, not in my direct line, but in our line. So I knew that I should do it, but I also am one of those people that even though I know I should do it, it still makes me fearful. And it's almost kind of like ignorance is bliss. Even though it's not wise, it's bliss. And so I put it off. And then I went for, you know, another examination from my doctor. And she's like, hey, you know, you haven't had your mammogram yet. Cause I was now in my 40s. And I was like, no. And she's like, why not? I'm like, oh, you know, I'm busy. And she's like, you need to take care of yourself. If you're not healthy, how can you take care of other people? So they booked me, they booked me in for one. And I went in, it was probably about 3 months after seeing my doctor, and I was really nervous. And also because it's just a new experience. I've never had a mammogram. It was just weird for me. And so, you know, I had always heard about like the pain and the squishing of the machine. And I'm kind of like, why is your breast being squished and then x-rayed a good thing for your breast tissue? I was so on the fence about it, but I went and I did it. And it can be a little bit awkward. For those of you who haven't had one before, take your clothes off, waist up, put a gown on that opens in the front. And there is a technician there with you. And they guide your breast into the machine, and you have to stand, you know, your arm up, you're in, and the machine comes down, squishes it a bit. But I have to say the mammogram discomfort was not what I thought it would be for the screening mammogram. It was actually okay. Like, it wasn't bad. So yeah, the most awkward part of that is just having somebody come in and handle you to get you in the right position. But of course, they're professionals and they're quick, and they make you feel very comfortable, and it's okay. So the technician did tell me, because it was my first mammogram, not to be surprised if I got a call back. She said that it's very common for women to receive a call back after their very first mammogram, because she's like, just explained it like it's a blueprint of your breast, and they don't know what your personal normal is. So there's quite a high percentage of women who get called back just to make sure and investigate to see because they want to rule out anything that looks different, because we're all different. So I did have that heads up, thankfully. And she said to me that if I got a call back, it would probably be for like an ultrasound, just to take another look. So over a week went by and I heard nothing, and I thought I was in the clear until one day I got a message on my answering machine, because yes, I have a home phone and an answering machine still. Got young kids at home, they need to make sure they can call out and call in when they need to. Anyways, that's a side note. So I got this message and they had called me back, and it wasn't just for an ultrasound. It was for an ultrasound and a diagnostic mammogram. And my heart sank, because I knew logically that if they had just seen one of the more normal first mammogram questionable areas, it would have just been one of those. But the fact that I had to have an ultrasound and a diagnostic mammogram, I knew that they were more concerned than they would normally be. My doctor called me. She, just wanted to really make sure that I got this investigated. She told me once again, it was in my left breast. And I'm like, oh my goodness, like what's with the left side? And I said to her, this is where the milk cyst was. Is there by chance this is like residual, or like, because even though I couldn't feel a single thing, I'm like, is it residual? Is it, maybe dried up in it? And she said, of course they can't, they wouldn't know without investigating. So to follow through. It was pretty quick after I received that call that I was able to get in for my appointment. I think it was about like a week. It wasn't very long at all. And that was good, because again, mentally, psychologically, it is such a burden to carry. And I found out that news on my mom's birthday, and I couldn't even call her, because if you're like upset in your heart and you talk to your mom, that you're probably going to cry. And it was her birthday. I did not want to worry her. I did not want to burden her with this. I didn't want to burden anyone with it until I knew for sure what it was. So it was a journey that I went on and through with just my husband knowing. I didn't want to scare my kids or any other family members or close friends. So it was really hard. So at the ultrasound, I did again let them know about my past situation in that breast, and they checked it out, and they also did the diagnostic mammogram, which, let me tell you, was painful. Heads up, it does hurt. It is not comfortable at all. They squish your breasts and it pinches, because they really need to get in there and make sure that they're getting as good of a shot and an indication of what's going on in there. And I am not one to make a lot of noise when I'm in pain. Like even in childbirth, I tried to keep it in. Like, of course there was some noises, but I'm not a person that's like, ow, ow, that hurts, when you're a dentist or if you hurt yourself. But with this, I did vocalize. I'm just like, it was so painful. Thankfully short, but yeah. So I don't want to scare anyone, but we need to keep it real here, right? So after the diagnostic mammogram and the biopsy, or not biopsy, after the ultrasound, I stayed there while they looked through the information. And then I believe it's a radiologist. They came in and she talked to me and she said, she would have loved to have been able to give me the all clear. And here I am. Oh my goodness, here we go again. But she couldn't. She said, there's something there. It's not normal. They do not know what it is, of course, but they're very concerned. So I needed to schedule a biopsy of the area. Now, the time between the diagnostic mammogram and ultrasound and the biopsy was really close. It was just a matter of a couple of days. And thank God. Oh, so nervous. So once again, my kids don't know. I dropped them off at school. I take myself for the biopsy, and it was something else, just like everything. Thankfully, they do numb you, so it doesn't hurt. It was okay. But you lay down and they, numb you, they clean the area, and they watch on a monitor, and they took out 3 samples from me. And the person doing it was very nice. It's a good group of people. The hardest part for me in those areas and those parts of the hospital are always the waiting area. It's very doom and gloom. Lots of women there, all with your, robes on, and everyone knows why they're there. And the mood in the waiting areas, it's thick. But when you're with the workers, they really are kind, patient, and try to be of happy spirit, which is really helpful in those situations. So he took 3 samples, and then when they're done, what they do is they put in a little indicator inside, so that if it comes back, if the biopsy comes back bad news, then of course they're going to have to go in and do surgery or whatnot to remove the tumor. But if it comes back as benign or not anything that's of threat, they want to have an indicator put into your breast, so that the next time you get a mammogram and that spot or that area comes up, they can say, oh, okay, this is different, but it's been investigated and we're okay. So 3 samples, then an indicator goes in. After that, they put the strips, so they don't stitch you up, but they put the strips on, the steri strips, and you go get another diagnostic mammogram to make sure and double check to make sure that indicator is in the right place. I did request to him, I'm like, that really hurt last time. Is it possible to get more of the screening mammogram, or at least a 50-50 between the diagnostic and the screening, so it's not as painful? And he said, yeah. So he talked to the worker, and she put me in, and it wasn't as crushing that time, which was really nice. So once they knew that the indicator was in place properly, I was good to go. I was not allowed to shower. I think it was 3 or 4 days, because the strips and the wound, they needed it to heal. It had to stay dry. After a few days, the strips do start to naturally come off. And I was starting to shower with the strips, at least a couple of them were still on, because I remember specifically the day that the strips came completely off. I knew the area was bruised, because you could see the bruising past the strips, because it's quite traumatic to the area. What I was shocked by was my psychological reaction when the strips had finally all came off and I saw the wound there. It's not like it's big, but the area was very bruised. There's a circular region where they would go in and out for the biopsy. And surprisingly to me, when I saw that area exposed for the first time, I broke down. I lost it. It was, I don't know if it was just, I couldn't hide and push away my fear, because, as a mom and you're going through your day, you have it always in the back of your mind that you're being tested for something and something could be wrong. It's there, but I really had to work to push it back so that I could still continue on. And it was not easy. So I think that when the strips came off and it was fully exposed, it all came out. All the stress, all the anxiety, all the fear. I literally, I could tear up right now. I broke down. It was an emotionally painful release for me. They had given me, I think it was 2 weeks for the biopsies to come back, and for my doctor to be notified. Thank God it was just under 2 weeks. My doctor called me right away as soon as she got the results that it was benign. And oh my goodness, what a relief it was. And she had said that they it didn't come back necessarily inconclusive, but it was a cluster of cells basically that were benign, and that I was okay, and that I wouldn't need to get any further treatment or procedures done. And she just wanted to let me know as soon as they came in so I could exhale. And boy, did I. It was the best news you could have. Because you can try to stay as optimistic as you want, but until you actually get the all clear, there is that part in you that knows it may not be. And how do you go forward? So I got the all clear, cried again, just let it out. Because that's what your body, you need to do, right? It was absolutely exhausting. Let my husband know right away, and so that he could have that as well. And yeah, it was the best news. After that, I ended up calling my mom and just letting her know why I didn't call on her birthday. I had texted her and sent her messages and kind of made up a thing of, I was busy, which I was. I just didn't tell her what I was busy with. And I let her know, look, I didn't want to burden you with this. I don't know how long the process would go before I'd get the all clear or the bad news. So I didn't want her having to carry that. So she understood and was of course very grateful that I got the all clear. All right. So the biopsy area took a long time to heal. And so I just want to give, realistic expectations with that as well for anyone who's going through it. My scar did not leave completely for a year. It healed, but there was a scar and a mark there that every time I was undressed, I was reminded of it. And, part of me for a while would feel the trauma and the fear, but then afterwards, it was the gratefulness of, thank goodness, I'm okay. So many women hear the bad news. I am grateful that I was one of that could hear the good news. And I don't know if it's because I'm pretty fair-skinned. Fair-skinned people scar, like you see it longer, but it was a whole year. Since then, I have had one more mammogram, and needless to say, when I went in, I was nervous because every time I go in and get these girls looked at, I always get bad news. And I held my breath, I felt like, for 2 weeks after that mammogram, and no call. First time ever, and it was just, I knew it was going to be okay. I am really grateful that I went in and got these mammograms, or this mammogram done, because as scary as it is to hear back from them, or to be fearful of hearing back from them, the whole process was scary. But the alternative is worse. If you do not get investigated and there is something there that is of concern and there's cancer, it can grow and it can spread. And I much rather have the fear for a short period of time versus the long-term negative consequences of not seeking, not going in and getting the procedures and the work done early. Because of course I did a lot of research during that time and read a lot. And statistically, the chances of you having a successful recovery and treatment when you catch it early it's really high, really high. The longer it goes, of course, the worse it's going to be for you. So I encourage every woman, if you have not yet received your first mammogram, or if you have received your first, but you've put off getting subsequent mammograms, even if it's not every 2 years, try to make it regular so that you know that you are giving your body the best chance it has. Thank you everyone for listening to my personal journey with these scares. I do hope I did not fill you with fear, but with hope and knowledge of the process that can take place. And I hope that someone out there will find this information useful. Make sure to take care of yourselves, regular breast examinations, and when the time comes, your mammograms.